Hi, I'm Zachary Weiner, founder of VXPASS. Today we're going to walk through a demo of the full process for patients and providers. So the first thing that you're going to see is that on your screen, you'll notice that on the left side, we have the patient application running, and on the right side, we have the secure provider application running. So the first thing that we'll do is create a new account for the patient. And we do that as easily as clicking the new patient button. Now you'll notice we didn't ask for any personally identifiable information. We didn't ask for your email address or your cell phone number or anything like that. Those things are not attached to your account on the blockchain. So what we have done here is we've stepped out and created you a secure account on the blockchain, and now we're going to secure your passcode. And so once the passcode is created, we can create your VXPASS space on the blockchain so that your account can easily access it, and you, the patient, can share your ID with any provider with simply scanning the QR code that has embedded the patient ID. So in this case, you'll notice that on the right-hand side, the secure provider app is set up so that the provider, whether that be a nurse, a doctor, or a mass vaccination center, has the Moderna vaccine loaded in memory. Now the patient is going to place their QR code in the view of the scanner so that their ID can be read. And the provider application will check the blockchain to see, in this case, if the patient has any receipts or stamps on the blockchain related to vaccines. And in this case, the provider application indicates that the patient is a new patient. So we've been presented with a send button on the lower right-hand side. When the provider clicks the send button, the application writes a receipt or a stamp to the blockchain that the patient now owns. It includes some details about the manufacturer, the lot ID, the expiration, also that the patient can own and retain that information when coming back for their second dose, whether that be with this provider or any other provider. So now if we take a look at the provider screen, the provider checked that not only did they distribute the stamp for the patient, but they checked the blockchain and it does exist. So if the patient were to go and check their first dose status again, let's try that one more time and just make sure that it updates in real time. You'll see that they are indicated that they have received the first dose of their vaccine by a big green check mark. And we present to them some information about the vaccine that we've recorded so that they can know and stay up to date on what the threats are to them based on the manufacturer that they've received. Now, if we go to try to get the second dose or check the completion status, you'll notice that the patient is told that they have to wait 28 days. And that's based on the protocol of the manufacturer. In this case, we chose the Moderna vaccine, so the patient has to wait 28 days. If we had done the Pfizer vaccine, they'd only have to wait 21. So let's check again in a few days, and then we'll fast forward to their second visit. And then in a few days, the patient will check again whether or not they're eligible. And they still have to wait a few more days. So let's fast forward 2 more weeks. And so now the patient has waited long enough to become eligible for the second dose of their vaccine. They'll return to the patient application and go ahead and log in. Their secure passcode's been saved, so all they have to do is click the button, and they'll be presented with the QR code that allows them to be scanned at any provider to receive that second dose. So now if the patient is to arrive at a location where the provider only has, let's say, the Pfizer vaccine, when the patient scans their ID through the secure provider application, you'll notice that the provider application on the right-hand side is indicating that the patient is within the window, but they're not eligible for the type of vaccine that we were about to distribute. So the practitioner is prevented from taking the next action, which would lead to them actually injecting the vaccine. And so now the patient is able to find somewhere that does have the second dose of the Moderna vaccine as needed for their situation. So on arrival, they'll show up at the nursing station or go to the exam room or drive through the line and provide their ID to the practitioner or provider. simply by scanning just as they have before. The provider application has gone and checked the blockchain and sees that for this patient, even though the data was created by another medical practitioner, for this patient, we can verify that they've received the first dose of the Moderna vaccine and they're within the window of receiving the second vaccine. So we'll go ahead and inject the vaccine, and then all the nurse or practitioner has to do is click the send button. And at this point, the patient now owns all of their data. The doctors or practitioners were able to verify and validate what was necessary for them to take the next steps in the protocol without having to communicate with one another. There was no calls between front desks, and there was no need for systems integration. And now that the data is written to chain, the provider application has gone and checked for this patient what the status is. And you can see on the right-hand side of the provider application, the first dose was administered properly, the second dose was administered properly and within the time window, and now the protocol is complete. So if the patient were to check their second dose status, it'll update in near real time to show them that the stamp has been distributed and they own it, that it's been completed and written to chain, and that the details of the vaccine are available for them to check at any point in the future. And so the last step for them is to check their completion status. At this point, we'd expect that they've been completed or that the protocol has been completed, and you can see that it has been. The patient owns all of this data and can bring it with them. The doctors or nurses, and more importantly, mass vaccination centers did not need to communicate with one another in order for the patient to complete their protocol. This demo was completed in very short order, and you were able to see blockchain, security, data ownership, and health records all demonstrated very, very efficiently. Thank you again. I'm Zachary Weiner, founder, VXPASS.